go. Good day, everyone. This is Vice Consul Elvi de Guzman. I'd like to welcome you all to the Philippine Consulate General in Calgary's online forum education series featuring Dr. Daisy Ann Habido Artuz, child and adolescent psychiatrist from Alberta Health Services, who will share her insights on stress reactions, psychopathology with a focus on the impact of the COVID-19 pandemic on mental health and psychological first aid. Before we begin, let us go over some reminders. Please be informed that this session is being live streamed on the PCG's Facebook page. We would like to remind the panelists and reactors to please keep their microphones on mute to minimize background noise during the webinar. We encourage our reactors to share their insights and ask questions, and we request that they speak and ask questions concisely. Please limit each intervention to no longer than 1 minute and 30 seconds. Finally, we also encourage our attendees to ask their questions and share their views and reactions by using the question and answer function of the webinar. Please keep your questions and comments on topic. On the screen now is the program for this session of the PCG's online forum education series. Consul General Zaldi Patron will deliver his opening remarks to formally start the session. I will then introduce our featured expert today, Dr. Daisy, before she proceeds with her presentation. She will then open the floor for the question and answer forum after her talk. We have about 15 minutes for Dr. Daisy to address comments and answer questions. During the 15-minute open forum, our two reactors will be given 2 minutes each to share their opening insights. The first reactor is Ms. Faye Santos Vargas, the president of the Filipino-Canadian Association of Saskatoon, and the second reactor is Ms. Lenny Zuniga, career practitioner from the Center for Newcomers. Reactors may have further interventions where they can share their insights and ask further questions later throughout the open forum. This is where we request that they limit each succeeding intervention to no longer than 1 minute and 30 seconds. By 6:50 p.m., Dr. Daisy will give her concluding observations and closing message for the attendees and reactors, where she may summarize what she wants for us to remember as the key takeaways of the discussions. At 7 p.m., Consul General Zaldi will deliver his closing remarks and formally end this session of the PCG Online Forum Education Series. Now, to formally start this session, please welcome Consul General Zaldi Patron. Consul General Zaldi, you are now on the spotlight. Please unmute your mic. Thank you.
Thank you so much, Vice Consul LB. Good afternoon to my fellow Filipinos and to all the listeners of our session today. To those in the Midwest and the West Coast, good evening to those in the East Coast, and good morning to all our listeners in the Philippines. Welcome to the second online forum education series of the Philippine Consulate General in Calgary. I'm Consul General Zaldi Patron, and I am joined here by all the personnel of the PCG, as well as our distinguished guests, participants, friends, and followers of our FB page. Earlier, it was mentioned that we are fortunate to have with us Dr. Daisy Ann Habido Artuz, a Filipino-Canadian child and adolescent psychiatrist working at Alberta Health Services. We are truly grateful to her for allowing us to listen to her presentation. This online forum is part of the PCG's Gender and Development, or GAD program, that aims to highlight the roles of Filipino men and women in the family, at work, and in the society. And Dr. Habito Artuz is one of those we would like to highlight at this in this session. It is also our way of reaching out to the Filipino community in Alberta and Saskatchewan by discussing issues and concerns affecting our community. The government of Alberta places great importance on the mental health of Albertans, so much so that as of May 2020, the provincial government announced a total of 193 million Canadian dollars for a COVID mental health action plan. Recently, the Alberta government announced a one-time grant funding of up to 25 million Canadian dollars for eligible projects and services to enhance community mental health and addiction recovery support and services. Last month, the PCG in Calgary collaborated with the Philippine Overseas Labor Office or POLO and the Overseas Workers Welfare Administration or OWA on a webinar titled Overcoming Mental Stress During the Pandemic. This highlights the importance of talking about the blue elephant in the room as we continue to navigate life and work amidst the COVID-19 pandemic. Hopefully, when this is all over, we will all emerge stronger in mind, body, and spirit. Without further ado, I give the floor back to Vice Consul LV de Guzman, who will introduce further our resource person for today. I hope that we will all have a fruitful discussion. Salamat po.
Thank you, Consul General Zaldi. Today's featured speaker is Dr. Daisy Ann Habido Artus. Dr. Daisy is currently practicing as a child and adolescent psychiatrist from the Child and Youth Mental Health Team of Alberta Health Services in the North Zone. Dr. Daisy earned her degree in 1995 as a Doctor of Medicine from the Davao Medical School Foundation in the Philippines. She obtained her license as a Doctor of Medicine in 1996 and became a resident at the General Adult Psychiatry section of the Department of Psychiatry at the Davao Medical Center in Davao City in 1997 before she went on to become a subspecialty fellow for child and adolescent psychiatry at the University of the Philippines and the Philippine General Hospital's Department of Psychiatry and Behavioral Medicine in Manila, Philippines. She has been serving as a psychiatrist at the Queen Elizabeth II Hospital after taking the Medical Council of Canada's evaluating examinations in 2004. We are very pleased to have her here with us. Dr. Daisy, I will now set the spotlight on you. Please prepare your presentation. All right, Dr. Daisy, you're on.
Good afternoon, everyone. And thank you, Vice Consul LV, for the kind introduction. I know I have a long last name. So when I came to the North Zone and practiced as a child psychiatrist, I introduced myself as I go by Dr. Daisy. And because I work with child and youth or patients less than 18, they like the name because to them, it reminds them of sunshine and rainbows and everything nice. So I am pleased to be with you today because I am a psychiatrist. I diagnose and treat mental illness, but I am also a strong advocate for mental health. And I think the other day, Consul General Zaldi Patron said, talking about your mental health during the health crisis is very timely because, as he said, this may change us, but in the end, we're going to come out stronger, not just physically, but hopefully mentally as well. However, bear in mind that mental health is not just important during the health crisis, but it is also important during in your everyday life. So this is the blue elephant. It's the blue elephant because it's there, obviously, but we don't want to talk about it. We try to avoid talking about our own mental health. But we are now, as Filipino Canadians, we are in a setting where it's okay to be not okay, and that's your mental health. So for this presentation, I have no actual or potential conflict. I have absolute permission from from Alberta Health Services to share some materials. Mental health is such a broad topic. I will try as much as possible to zero in on what's relevant, and I'm hoping I can keep within the time limit. Hopefully, please, Vice Consul LV, please remind me if I go overboard. Sometimes sometimes I do a lot of ad lib and I lose track of the time. So these are the objectives of this presentation. For the first part, I am hoping to discuss central concepts in psychiatry, and that's mental health and mental illness. When do you say you need to see a professional, and when do you say this is coping, this is stress reaction? And another objective will be for our participants to self-identify signs of psychological distress, stress reactions, and know when to seek professional help. And yes, we are in the middle of the pandemic, so we have to understand how it impacts our mental health. For the second part, I will try to go through the different stages of grief, because we know very well that during this health crisis, we've experienced a lot of losses, and that in itself causes a lot of grief. So I will talk about the different stages of grief, which I'm sure some of you know. They are the stages of death and dying introduced before by a psychiatrist. And lastly, I would like to introduce coping strategies or ways that we can manage our stress, especially during these difficult and unprecedented times. Okay, just to start off, as I said, mental health and normality are key concepts in psychiatry. It's very hard to define. Psychiatry. Okay, I think current slide. Okay, sorry for the technical glitch. So I will now start with the main topic. So as I said, mental health and normality are key concepts, but they're difficult to define. Nobody can say whether or not you're normally mentally healthy. In fact, the father of psychiatry, Sigmund Freud, said that normality is a fraud. It's not something. It's not easy to define, and in fact, it doesn't exist according to Sigmund Freud. But for purposes of discussion, when you say you are normally healthy, you're able to translate playing to work. You're able to love another person. You're able to stay in a fruitful, in a productive, and a meaningful relationship. You're able to handle conflicting emotions. It's normal to feel emotions every day, but you have the ability to handle pleasant and unpleasant emotions. You're also able to learn by experience, and this is how children build on their skills. They learn by experience. Hopefully, this is translated from childhood to adulthood. The fourth item is very important, especially during this pandemic, because we should be able to adapt to the new quote-unquote normal. We are going into a changing environment. So if we are normally mentally healthy, if we are resilient, which equates mental health, then we should be able to adapt to this changing environment. Another thing, this also talks about your emotions. If you are normally mentally healthy, you experience fear and guilt, but they should not bring you down. You should be able to live without fear. I don't know if we're able to do this at this time of the pandemic, and I will discuss eventually throughout my presentation. And yes, we feel some degree of guilt as well, but this should be within normal range and intensity. And another important thing to consider if you're saying you're resilient, you're mentally healthy, is you should be able to take responsibility for your own actions. You should be able to be independent, to be self-sufficient. Now, this is again put into a challenge. We are placed in a difficult position because of the pandemic. So that's mental health and normality. What's the opposite of mental health? So it's mental illness. In psychiatry, we call it psychopathology. But this is basically the answer to the question, when do you need to seek professional help? As I said, I am a psychiatrist. I diagnose and treat mental illness, but I advocate mental health. I practice child psychiatry, but I see adult patients as well. Yes, I'm a psychiatrist at the QE2 hospital because I see adult patients. So when do you need to see us or maybe speak with a counselor or a therapist? So we come up with we try to look at different areas. So it's either problems with your thoughts, your behavior, your functioning, and your emotions. So when you talk about thoughts, so how do you think? What do you think is your cognitive pattern? Are you geared towards what we call cognitive distortions? You are an absolute thinker. It's all or nothing. It's black and white. You're very rigid. You overgeneralize. That means to say everything's negative. Whatever happens, you always perceive it as negative. I think some of it, in layman's term, this is what you call, you see the cup half empty or half full. You discount the positives. Even if you've done a good job, you don't acknowledge the positive thing that you've done. You always jump to conclusions. That means to say you're almost like a fortune teller. You know that some kids would say, I know things are going to turn bad. So that's another cognitive distortion. So if you think this is the way this is your thought pattern, then then reflect even more. Should statements. This is almost related to an all or nothing thinking. You always put pressure on yourself. You always want to do everything. I should have done this. I should have done that. In this time of this pandemic, I should have saved more money. I should have spent more time with my kids. So this is how you think. You always use the word should and would. Labeling, that means to say you use labels. For as a child psychiatrist, I always hear kids say, especially those who struggle in school, they tell themselves they are dumb, they are stupid, and they are good for nothing. So if this is the way you think, again, reflect on your thoughts. Another area to look at if you're thinking about psychopathology or mental illness is your feelings. It's normal to feel different types of emotions. It's normal to feel upset, angry, low, down in the dumps sometimes. But if you think you're feeling sad daily for 2 weeks, then maybe there's something wrong. You could be experiencing what we call clinical depression. Do you experience irritability? Do you feel label indifference? When you say label indifference, do you just, I don't care what happens. So that's label indifference. Are you experiencing loss of interest in pleasurable activities? Are you experiencing what we call it in psychiatry anhedonia? The loss of interest. You always feel tired, don't seem to enjoy. You're not motivated to do anything. Do you have thoughts of impending doom? Do you have free floating anxiety? So these are signs that I think there's something wrong with your mental health. I think you're experiencing distress. And this is just one of the kids that I am working with, who would wake up in the morning with a thought, I wish I could just be dead and gone in this world. So maybe some of us have thought about this, or this particular line has crossed our mind at one point in time. Okay, so again, this is another kid who I am working with. When she wakes up in the morning, I feel like it's just another long day that never ends. I don't care what happens today. I just don't feel like waking up in the morning. So how does your behavior look like? So does that mean to say you're not getting enough sleep at night? So it's either you lack sleep or you're oversleeping. Are there any changes in your appetite? Are you eating more or less? Are you binge eating? Are you starving? Or do you experience disordered eating? Are you either restless or slowed down? So that means to say, do you feel like you need to move? Or you feel like you don't have the energy to do anything during the day? For some who are experiencing changes in their emotions, in their thoughts and their feelings, sometimes use what we call mood altering substances. Mood altering substances, for example, could be alcohol, it could be any form of those recreational drugs. So try to see, reflect on your use of substances. I think during the pandemic, there was an increase in the sales of alcohol and caffeine because people were using mood altering substances even more. In psychiatry, we don't just focus on the symptoms. We also look at your level of functioning. So functioning would mean your ability to work. If you're mentally healthy, you're able to translate work to play. We're going into the long weekend. A lot of families are going away for camping. So are you able to translate work to play? So when you're thinking about mental illness and psychopathology, are you experiencing problems at work? Do you go to work? Are you calling in sick more often? Are you late most of the time? So there could be something wrong with your mental health. Relationships. Are you able to stay in meaningful, sincere, and productive relationships? Relationships doesn't only mean intimate relationships. You also have to think of friendships. You also, especially with children and youth, and during the pandemic when school was prematurely shut down, it affected a lot of our children and youth's mental health. Another area of functioning that we look at is your ability to practice self-care. So self-care would mean, are you exercising enough? Do you practice personal hygiene? So these are just examples, some examples of self-care. So when we're thinking about mental illness vis-a-vis mental health, we look at these different areas of functioning within the context of the different signs and symptoms, the different changes that I talked about in terms of the way you think, the way you feel, and the way you behave. So that's psychopathology in a nutshell. Stress is a norm. Let's move on to stress. So how does stress affect our mental health? You know, stress is a normal part of human experience. It could be pleasant or unpleasant. What's an example of a pleasant stress is, let's say you experience you get a promotion in your job, or let's say yes, you're promoted. So that is a welcome stress, but with it comes a lot of responsibilities. Unpleasant stress, let's say losing a job, losing your job, losing a loved one, drastic changes to your routine. Those are examples of unpleasant stress. But stress is expected wherever you go, whether you're just driving along the road, you're experiencing stress. It is part of our everyday lives. So it can be real, symbolic, or imagined. Think about think about stress within the context of it being a threat to our survival. You know, you're mentally healthy, you're able to, you have your family, you enjoy your job, you live comfortably, and then something happens. So your homeostasis, your balance is threatened, so that we perceive it as stress. So when we experience stress, it triggers the body to respond, to diminish the impact and restore homeostasis, your balance, your status quo. That is the concept of stress. But our body, and there's it's proven by science that stress and physiological functions, that means to say our body, are interconnected. So these are just some of the points why the body and the mind is connected, especially when you're experiencing stress. We already know that when somebody is experiencing, I would say, an unusual level of stress, the brain would, there are certain changes in your brain. We call them neurochemicals. And from among them, serotonin has been implicated in anxiety and depression. Another way by which our body responds to stress is through our endocrine system. Cortisol is just another neurochemical. I'm just pointing out important neurochemicals that are relevant to the physiology, to the topic of stress. Cortisol is a chemical in the body that is not that is usually elevated when we are experiencing stress, and it is not good for the body. It's neurotoxic. That means to say it affects the brain. That's why if you're experiencing stress, you also experience confusion, forgetfulness. You're unable to pay attention to what you're doing. So that's an example of how cortisol affects the brain. The immune system is also very sensitive to stress. We are in a state of the health crisis. We know for a fact that we're experiencing stress, your immune system goes down. So during the health crisis, this is also something that you have to really look into and pay attention to. But the important thing to remember when you talk about stress is learning how to identify the way you respond to stress and to be proactive in managing your level of stress. In that way, you build on your resilience, you restore mental health. The next slide would talk about stress reactions, and I hope the audience would reflect on how you respond, how your body responds to stress. So it could be in the form of physical symptoms. Yes, you feel tired, you can feel like your heart is racing, you experience palpitations, you're easily startled with the sound of anything. But remember, we respond to stress in many different ways. This is unique. You may respond one way, but the other person does not. So it's tailored. It's different for every person. As I said, mental. We also experience confusion. We have difficulty paying attention. We have difficulty making decisions. So maybe this is how you respond to stress. Now, if you notice you're experiencing this, so that's a red flag. When you're under stress, do you pace? Do you walk around? Do you experience problems with falling asleep? Do you have experience insomnia? So insomnia could come with either difficulty falling asleep, staying asleep, or waking up early in the morning. Or maybe you're not getting restorative sleep. You may be sleeping 10, 12 hours a day, but you still feel tired the following day. So does that mean you're experiencing stress? Or does that mean your level of stress is elevated? Withdrawal or social isolation. Do you find yourself preferring to stay at home or refusing to talk to family and friends? Do you feel on edge? Do you feel tense? Do you feel worried all the time? And it's constant and it's difficult to stop. Do you feel hopeless? Maybe you feel scared. Nothing's going to change. This is it. This is the end of it. Or are you quick to anger? So are there changes to your emotional reactions? People in the house would notice that maybe you're starting to be more irritable and angry. So does that mean you're experiencing stress at work or stress from family interactions or maybe just stress from listening to the news about COVID-19? So the audience, this is a question for the audience. If you can come up with a list of your reactions to stress, try to pay attention to how or whether you respond more with behaviors, you respond more with emotions, or you experience physical symptoms. Sometimes they come one after the other, or sometimes they come in combination. Remember that they are warning signals. They are almost like alarm bells. They are telling you, okay, I think you need to do something. Your body, your homeostasis, your sense of balance is being threatened. So you have to do something. You have to learn how to adapt and cope, practice your stress management strategies. The main goal of stress management, the main goal of coping overall to stress is to restore your balance. Balance at work, with your own self, with your own family, with your friends. So this is the main goal of stress management. So I think this is the last part of my. This is the last slide for the first part of my presentation. I will now move on, zero in on the pandemic. So this is COVID-19. We are in the middle of COVID-19 pandemic, but this is almost like a disaster. I don't know, or I don't know who among the audience is familiar with the concept of a disaster, but we are actually experiencing. If you look at the whole COVID-19 pandemic, this is almost this meets the criteria, the description of a disaster. It's not hydrologic or geologic in nature, but this is a disaster in itself. So when you say, okay, sorry. So when you say disaster, yes, a very good example of a disaster in the most recent in Alberta was forest fire last year, but before that there was also flooding in Calgary. Those are examples of disasters, but these disasters have negatively affected a big portion of the population. So it was in March 11, 2020, when the WHO declared the novel coronavirus a global pandemic. This was primarily because there were alarming levels of spread, severity, and inaction. As the pandemic evolved, I think there was some debate about the WHO being very much delayed in declaring it as a pandemic, but we have to bear in mind that they have different criteria as to when they would declare it into a global pandemic. So everybody knows it was in March 11 that it was finally declared that this is a global pandemic. And then after that, a lot of changes started to set in. Okay. So when you say disaster, these are the characteristics of a disaster. It global impact. It affects the whole world. Look at the pandemic. I think as far as statistics are involved is concerned, we're now within the 4 million range of those who tested positive for COVID-19. So it's global. Usually, a disaster has an identifiable ending, just like the forest fires in Fort Mac, flooding in Calgary, and I think it was back in when I first came to Grand Prairie in 2016. We also experienced flooding. So there's usually there's an ending, but look at but within the COVID-19 pandemic, we're hoping that the ending comes when the vaccine becomes available. But there is a lot of uncertainties. We don't know when it's coming. So that in itself can be stressful. It is outside the realm of ordinary experience. We don't usually experience flooding, earthquakes, fires. We don't experience this health crisis. For most disasters, it leaves a footprint. Now, depending on the intensity, depending on how widespread the disaster is, it definitely leaves a footprint. Since the pandemic started, you will see later on that there has been changes in mental health, and some of this could eventually lead to mental health issues, eventually mental illness, possibly some post-traumatic stress symptoms. The thing to remember with every disaster is that it has the ability to induce stress and trauma. So whatever a disaster we encounter, it's almost expected that there is the people who are affected experiences stress and trauma. So why is mental health important during the pandemic? So why is it that we need to make sure that we pay attention to how we feel, how we think, how we behave? Now, if you look at the whole the pandemic, there was there were loss of lives. whether direct, they were impacted, they were affected, they tested positive, and they lost their lives because of COVID-19, or there were lack of the lack of friendships, connections, and this can lead to grief and mourning. When schools were shut down, and not just schools, I think when we were told to stay at home, we cannot work, so everything was disrupted. Our routines was disrupted. We were told we cannot go anywhere, and that could trigger anxiety. Okay. We always experience a threat to our health, and that can incite fear. You know, the most important, self-isolation is the only way to combat, or the key to controlling the pandemic. That's why we were told to stay at home. But we cannot stay at home forever. But whenever we go out, either to work or to shop, we always experience the fear, because we don't know. This is an unseen enemy. We don't know if we're going to get COVID-19 or not. There's a lot of feelings of uncertainty for the future. I think millions and millions of people around the world are unemployed. There's a lot of loss of financial resources. There's loss of social connections. Loss of our personal lives have been impacted. I'm sure most of you had to cancel plans for travel, plans to spend time with the family, and this leads to a lot, and this threatens your sense of self-efficacy. So from this, you're very uncertain about what happens then in the next 6 months, 6 to 12 months, and this in itself is very stressful. Remember, if things are uncertain, that can trigger a lot of anxiety. Now, Filipino Canadians are aware that the Center for Addiction and Mental Health in Ottawa is the biggest center for this research on addiction and mental health. And as of July 30, 2020, these are the statistics that they came up. When the pandemic started, 21.5% experienced moderate to severe anxiety. This is around May. The survey was conducted in around April to May, but as of July 30, it went down to 19.5%. But that's still a big number. They're experiencing moderate to severe anxiety. At the start of the pandemic, 23.7% were isolated. They were feeling lonely. It went down to 21% when we started opening up. 21.2% felt depressed as of July 30, and now it's down to 18.4%. Look at binge drinking. From 24.7, it went up to 26.6. As I mentioned earlier in my presentation, there has been increase. There was an increase in the sales of alcohol and caffeine when the pandemic started. But this is not mental illness. These are mental health. These are symptoms of acute stress. This is mental health. This is not mental illness. And they also found out that women with children less than 18, those who have to take care of very young kids at home, and young adults 18 to 39 years old are likely to feel both depressed and anxious. And I think we can understand that. You know, when schools were shut down, parents were forced to parent, to teach, and at the same time work. Why young adults? Because these are adults who just finished college and university and are just starting to work. So they are most likely to feel depressed and anxious. And I think we cannot underscore the fact that those who do high exposure jobs, the essential workers, healthcare workers, those who work in the grocery shops experience more anxiety because there's more exposure. Truck drivers experience more anxiety. Change or loss of employment? Almost 50% has reported that they are very worried about loss of income. And I think there's no need to explain why more than almost 50% are worried about their financial stability. Okay, so mental health and mental illness, that's I talked about the difference between these two concepts. We talked about COVID-19 pandemic within the concept of mental health within the concept of the COVID-19 pandemic. We talked about stress reactions. Now, another way to look at how our mental health reacts or responds to the health crisis is looking at or understanding the concepts of loss and grief. Now, Elizabeth Kubler-Ross is a famous author of a book entitled A Death and Dying. She's a psychiatrist. She's also a thanatologist. She specializes in the study of death and dying. She introduced the different stages of death and dying. And as I go through the different stages, try to reflect on yourselves, which stage you are in. Because, grief is a normal human reaction to loss. And when we think about grief, we think about losing a loved one to maybe to cancer, losing a loved one to an incurable disease. That's how we usually, how we correlate grief to. But in these unprecedented times, there's been a lot of loss. As I said, there's cumulative loss, massive loss almost. So try to reflect as I go through the stages where you are on the different stages of grief. Okay. So stage 1 is denial and isolation. So let's say, especially when I think we had our first case back in January, and I think we by March, before it was declared a pandemic, the U.S. only had, I think, a small number of cases. So initially, when it first started, we thought, oh, maybe 80% of those who were diagnosed or tested positive with COVID-19 is mild. It's just like the flu, right? So we try to minimize the impact. And most of us were thinking it's going to be all right. And this is already famous. There's only one case from China, and eventually it's going to magically disappear. So you see the magical thinking, the fantasy, the tendency to fantasize. That could be a form of denial. And when you were tested positive, or let's say, you're saying, no, it cannot be me. I've been doing everything I can to keep myself safe and healthy. But remember, we all experience a certain degree of denial. It's almost normal to feel to experience denial. But remember, it should only be temporary. It should be replaced by partial acceptance. Now, as the pandemic evolved, as we get to know this virus even more, how fatal, how lethal it is, then we should move forward from denial to the next step. The first stage of death and dying is only a buffer. So that means to say it tells you to prepare for something. So when the pandemic started, we were saying, okay, it's okay, but unknowingly we were actually preparing. Remember, there was a rush to buy toiletries. The people were panic buying. So it's almost like a buffer. It's telling you to prepare for something. And this is what we told ourselves. During the stage 1, you are not alone. We are in this together. So that's a stage of denial. That's during the stage of denial. So stage 2 is about anger and anxiety. So this is actually described as almost like a roller coaster of emotions. Some days we feel fine. It's okay. It's okay. I don't feel tense. I don't feel fear. I'm not scared to go out of the house to go to work. It's okay. But another day you'd be irritated because you're told to stay at home. And for some, they feel like they're going crazy. So denial is translated into anger. We're angry because our lives are interrupted. We're angry because we're told to stay at home. We're angry because we had to cancel our travel plans. Kids are frustrated, disappointed, and annoyed because they cannot go on play dates. We're angry, we are resentful because we've lost control of our lives. In Canada, we have so much freedom. We can do anything we want, we can be whatever we want. But because of the pandemic, we lost control of our lives. And that can translate into anger, anxiety, a lot of different emotions. Frustration, there's a lot of, it's a roller coaster, it's up and down. During this stage of grief, death, and dying, anger can be projected and displaced. So we all know that people has become very angry towards doctors, towards science. They started to question, okay, how come you've had SARS before, you've had previous experience, how come you're not able to deal with COVID-19? Anger was also projected and displayed to WHO. Why did it take a long time for WHO to declare it as a pandemic? Again, anger is projected and displayed to certain cultures, certain groups of people. A Chinese flu, the label of the quote unquote Chinese flu is an example. So this is an example. This is stage 2. You're experiencing anger. You're experiencing not just anger, but different types of emotions. But again, remember the topic on stress reactions. If you notice changes to your emotions, this is telling us that, look, we need to do something. We need to address. We need to cope. We need to adapt. So let's go to stage 3. That is bargaining. If I keep on washing my hands multiple times, if I avoid touching my face, there's no way I can get COVID. So maybe if we do this, then I don't get the infection. So I remember when I was tested for COVID-19, I felt very frustrated. I was disappointed because, look, I do everything. I wash my hands, I make sure I don't touch my face, but why am I experiencing this? Fortunately, I tested negative, but this is an example of bargaining. Most of those who are in the third stage of bargaining do this in secret. We don't go out, tell people that, look, God, I'll do this. Please don't let me get sick. So most of this is usually done. This is almost like we're getting into an agreement, a contract with a higher being. In psychology, we look at it as almost like a quiet guilt. So this is your unconscious wish. So this is part of psychology. This is what I said. I will be okay if I do everything perfectly. I'll follow the rules. I'll take vitamin D. I'll take vitamin C. I'll take I'll drink supplements or herbs so that I don't get sick. So that is the stage of bargaining. So stage 4 is depression. Because of cumulative loss during the pandemic, we've lost jobs. We are disconnected from our friends. We cannot visit families. This can lead to some feelings of sadness and maybe depression. Again, if I will connect that with the topic on psychopathology, try to reflect. Are you experiencing depressed mood daily for 2 weeks? Are you experiencing problems with your sleep and your appetite? So the question is, am I clinically depressed? Do I need to see a professional because I'm experiencing depression that needs to be treated? But during during this stage 4, you're experiencing deep depression. You're experiencing shock and dismay. So this is just this is another stage of coping with grief and loss. What's the point? If I get it, I get it. So are you starting to feel hopeless? That means to say, okay, are you in stage 4, or do you need to see a professional? Do you need to seek therapy? For those who have loved ones in long-term care facilities, think, I should have taken him home with me. So are you experiencing guilt because you should have done something more for your loved one? Or I should have visited my family before the pandemic came. So yeah, so are you in stage 4? Stage 5 is acceptance. So when you've reached the stage of acceptance, that means to say you went through the stages already, but remember the stages is not linear. You go back and forth, back and forth. You may be accepting right now. You recognize your strength. Okay, I think I am very resilient. I was able to find another. I was able to keep myself busy. I was able to entertain myself. But the next day, you feel sad and angry again. Oh, why is this all happening? But when you're at the stage of acceptance, you're recognizing your strength. You're letting go of what you've lost. That means to say, there's nothing you can do with time lost. There's nothing you can do after losing time spent with family members. There's nothing you can do as a doctor after you've lost a patient to COVID-19. So you are already, that means to say you are in the stage of acceptance. And learning how to live with it is somehow, I think we're now in the stage of mitigation. We now have to learn how to live with it. So hopefully, most of us are in the stage of acceptance. Now, Elizabeth Kubler-Ross only introduced 5 stages, but lately they introduced stage 5. And this is finding meaning beyond grief. And this is how they talk about finding meaning. It's almost like you're holding your loss in your hands. That means to say it's too heavy. But eventually, as time passes by, you're able to just hold it with one hand and put your other hand in your pocket. And then eventually the other hand, you put it inside your other pocket. So that means to say the meaning, the loss has happened. You've found meaning beyond your grief. It's with you, but it's no longer that upsetting. So that is stage 6, finding purpose and motivation. So what is the purpose for all of this? What is this happening? I think when we all went into quarantine, we all reflected on what's important, what's our values. Families have realized that, look, I haven't been spending too much time with my family. I haven't been spending time on myself. So during the quarantine, this is the purpose. They found the reason for the whole experience of the pandemic. Okay, so as I said, reflect on the different stages. So which stage are you in right now? I think for myself, I'm in the stage, I still alternate, I still vacillate between bargaining and acceptance, because yeah, I don't think you can ever move forward from acceptance at this point, because we're not yet ready, where we don't have the vaccine yet. The grief process is not linear. So that means to say you go back and forth between stages. The important thing to remember is that to keep moving through the stages. Do not get stuck on denial. Do not get stuck on anger. Do not keep on blaming China. Do not keep on blaming the other person beside you or the other person in the office who tested positive. Do not keep blaming science. So keep moving through the stages. Self-awareness is the key. As I said, self-reflection. So try to pay attention to where you are in these different stages. Whatever you experience right now, practice mindfulness. Be non-judgmental. This is what you experience right now. So if you're experiencing sadness, this is how you feel. If you're experiencing anger, this is how you feel right now. So practice mindfulness and accept. Be accepting. And manage distress. Learn how to cope. Practice coping strategies. Support calm is with psychological first aid. That means to say, this is how you tell people that, look, what you're experiencing right now, if you're feeling tense, if you're feeling scared, this is a normal emotional reaction to an abnormal situation. I think we are experiencing this cumulatively. So support calm. That's how you support calm. Okay, so we are almost done. We're now we're going to talk about coping strategies, but I will start with how to manage each stage of grief. So if you think you're in stage 1, denial, and isolation. The goal is to stay grounded. When the pandemic started, we advise that you all, even if you're staying at home, you keep a routine. So when kids were not attending regular school, they had virtual classrooms. We tell families to always to continue practicing a routine from Monday to Friday. Taking care of yourself is another way to manage the stage of denial and isolation. We cannot underscore the importance of exercise in mental health. We know that when you exercise, you release good hormones, you release endorphins in your brain, and that's good for your self-esteem. It's good for your ability to pay attention and focus. Again, during this stage, make sure you get enough sleep. Remember that if you are sleep deprived, the following day you're either cranky or you're confused, you have poor function, you don't function very well. So make sure you get enough sleep. Diet, yes, again, I cannot underscore the importance of a healthy diet during when you find yourself in this stage. And avoid mood-altering substances like alcohol and drugs, because psychiatrists, we sometimes look at it as a form of self-medication. You feel better if you drink alcohol. So please, when you find yourself in this stage, avoid mood-altering substances. And if you are a psychological first aider and you see somebody who's experienced, who you think is in this stage, let them know that they're not isolated, you're in this together. If you find yourself in the second stage, validate your emotions. Like I said, if this is how you feel right now, if you're feeling sad, connect, talk to somebody, talk about your mental health. Filipino Canadians, we are in a setting wherein it's okay to talk about it's okay to talk about your mental health. It's okay to be not okay. So if you're sad, seek comfort. So talk to somebody. If you need to call a crisis line, do that. Set boundaries. If you are required to go to work and you don't feel comfortable, say so. Speak out. Practice compassion and kindness. Remember when the pandemic started, we've heard of stories wherein people go out in the streets or visit neighbors or visit long-term care facilities to show them that we pay attention to them, that we care for them. So kindness, practice kindness and compassion. So give out, maybe not just resources, give out your time, or maybe just taking time to say hello to a stranger, or maybe sending a message to your friend, or sending a small note or a text message to a longtime friend. So connect. Remember, human connection is a universal language. We all need to be connected at one point. But the main problem with the pandemic is that there's a lot of disconnectedness. So if you see somebody who's experiencing not just anger, but a lot of emotions, be compassionate, be kind, connect. Again, I cannot underscore the importance of emotions as a red flag. Okay. So let's move on to stage 3. So there is somebody who is in stage of bargaining. So if you think this is where you are, focus on what you can change, what you can control. Focus on the here and now, and maybe the next 24 and 36 hours. Do not go beyond that. You're going to be overwhelmed. Stay away from the what ifs. There's already a lot of uncertainties in this pandemic. So as much as possible, stay away from these uncertainties. If you're in the stage of depression, promote hopefulness. So again, if you are an unintended psychological first aider, you promote hope. You could tell somebody, your friend, your family member, look, I know it's hard, but there is always hope. Personally, you can create your own joyful future. Think forward, maybe imagine, maybe daydream about possibilities. I was with some of my colleagues yesterday, and one of our most senior colleagues is saying he hasn't been, he had to cancel a trip to visit his family this year but he's not, he says he's been daydreaming about spending the 2-3 months with them the next year when this is all over. So that's another way to support somebody who is experiencing depression. And remember, you are doing the best you can, and getting up in the morning is enough. um, we don't pay attention to uh, waking up feeling good in the morning in the past. But when the pandemic started, when you wake up in the morning and your sore throat is gone, oh my, you're so relieved. So remind yourself you're doing the best that you can, and thank if you're a believer, if you believe in a higher being, thank him, because you feel better, you feel good when you wake up in the morning, because there's a lot of uncertainty in this pandemic. Okay, stage of acceptance. If you're already in this stage, reflect on the results of your loss and see the gift. In mindfulness, this is what we call the silver lining. So always try to see, always find the good in everything, the silver lining. So maybe you were told to stay at home, but you spent more time with your family. Yes, you had to stay at home. You were not able to go to work, go to the gym, but you developed new hobbies. You've learned how to become a baker. I think Facebook was flooded with uh, newly discovered bakers. Build on your resilience by seeing what you did to overcome the loss. Be inspired. What did you do when you failed to visit your family members? So how did you overcome the loss? Finding meaning, as I said, finding purpose. Let go of things that no longer serves you. You do not hang on to missed time with family and friends. I hope that's the right way to say it. That means to say you cannot bring back time. Let go of those things. Do not get stuck up in those lost times, lost opportunities, and stay away from hopelessness. If you find yourself thinking, if you're an absolute thinker, and this is how you think, then if you're consciously aware, stay away from that pattern of thinking. Okay. We are potent as human beings. That means to say we have the ability to influence others. We have the ability to change ourselves. But we also have to accept the fact that we have limitations. So tell yourself, okay, I've done my best, but I can only do so much. Okay. So psychological first aid is another strategy, another way is another strategy or way to cope with the pandemic. It's a whole lot. It's a different training. It's actually with Alberta Health Services, but it's not. It's talks about active listening, empathic listening. You put yourself in the shoes of whoever you're talking with. It's non-specialized. You don't have to be a psychiatrist, a psychologist, a therapist. It's not. It's community-based. It's not done in the office. It's non-judgmental. It's respectful of individual coping styles. So that means to say, no matter who you're talking to, you respect however or whichever this person however he copes with the stress. Psychological first aid aims to support resiliency in the moment. That means to say what's happening right now and with a particular community. But in psychological first aid, you can either become an unintended. When you say intended, you go to the community who is experiencing the disaster and you implement psychological first aid, or you become an unintended psychological first aider, or because let's say you met your friend at the grocery store, and you start a conversation and you realize that your friend is experiencing anxiety, is experiencing hopelessness because of the pandemic. Then you become an unintended psychological first aiders, because you provide hope, you connect, and you support calm. Yeah. So this is the goal for psychological first aid, to reduce stress and help with the current needs. And this will address mental health needs at the moment in the community. Okay. So these are just essential elements in psychological first aid. You promote connectedness. As I said, human connection is a universal language. So if you see somebody who's feeling socially isolated, you promote connect. I'm going to show ways. I'm going to flash a slide with ways on how to promote, on how to connect, on how to inspire hope, encouraging self and community efficacy. Remember, after the pandemic, there's been a lot of loss. So, and because of these losses, our ability, our um, belief in ourselves to be self-sufficient has been challenged. So, in psychological first aid, you encourage self-efficacy. When you say support calm, you normalize the experience. It's a normal reaction. We are all experiencing, we are all in the same boat. This is a cumulative experience. When you say promote safety, there's a lot of information around about COVID-19. Make sure you get a credible source, stay informed, but do not overload. Okay, so this is with Alberta Health Services. For those who are from the audience, for those who are working with Alberta Health Services, they introduced this as to address mental health needs. So if you look at it, there are ways by which you can connect, by which you can stay active, by which you can give, by which you can take notice. They're talking about no, when you're feeling stressed, take note of maybe take some time to pay attention to what you see, what you hear, what you smell. So these are strategies, and yeah, keep learning, keep keep learning new hobbies, keep yourself keep your brain preoccupied with good things. Okay, so this is another strategy, mindfulness. We define mindfulness in different ways. My own definition of mindfulness is compartmentalization. That means to say, when I am doing this, this is what I do. So when you say you're being mindful, you do one thing at a time, you stay in the present moment in your full attention and without judgment. So during the pandemic, if you're experiencing this, it is what it is. This is what's going on. So these are just some example of the strategies, because the analogy of the monkey mind, our minds are very busy. So we are like monkeys. We're always chattering. So remind yourself, oops, I think it's my monkey brain who's acting up again. Okay, being in your body is a stress management exercise. Okay, I love this quote. This is also part of mindfulness. We always think that joy, when we're experiencing joy, this puts a smile on our face. But waking up, let's say, maybe starting with a smile in the morning can make you feel better throughout the day. So if you smile at a stranger, this can make you feel better, not just happy, but you also experience joy. So sometimes your joy is the source of your smile, but smile because it can be the source of your joy. I know it's hard to find reasons to be happy these days, but stay in the here and now and put a smile on your face. It's going to make you feel better. Okay, so in closing, your mental health matters. Consul General Zaldi Patron said that hopefully at the end of the pandemic, we'll all emerge as stronger, not just physically, but most hopefully mentally as well. But do not be afraid to talk about your mental health, because the health crisis is here. It's real, but it's your choice whether or not you're going. If you choose to suffer from the repercussions of the health crisis. Reflect on your own experience of grief. Where are you in the stages of grief? Whether you're in denial, you're in acceptance, find meaning. connect with friends, promote hope, inspire hope, support calm, let them know that this is we are all experiencing the same thing. Never waste a good crisis. Always learn from it. We all emerge from a crisis, maybe not the same person as we are, but definitely we're going to be stronger. We're going to be more resilient. I think this is my last slide as to my present regarding officially from my presentation. But I would like to leave you with this quote. This is from Alberta Health Services. Life is not about waiting for the storm to pass. It is about learning how to dance in the rain. So we're here. The pandemic is here. It's real, but we're going to come out stronger. So thank you so much for your attention. I am now ready for your questions.
Thank you, Dr. Daisy. May we now invite our reactors for their insights and possible questions. We will begin with Faye and then Lenny. So Faye, we will put you on the spotlight. Kindly make sure that you are not on mute. Dr. Daisy, can you stop sharing your screen so we could feature Faye? There you go. Thank you, Dr. Daisy.
Hi, Faye.
Hi, magandang gabi po sa inyong lahat. This is a very good opportunity. Actually, what I did was I had prepared two-part questions, but the first question that I prepared was clearly answered during your presentation. And thank you for doing that, Dr. Daisy. So, which brings me to the second question, and I will add a complementary question, which I think that both of them are relevant for all of us. So the first one is, how can family members or an outsider support an individual who is suffering, who is affected by this stressor? And the second part of that one is, are there differences in how we should be dealing with young person or versus an adult person?
So the first question, thank you, Faye, for your question.
Mm-hmm.
So your first question was about how you're part of a cohort. You are in one bubble. You're part of the family, and then one of your family members is experiencing stress.
Mm-hmm.
Correct? So
yes,
I think
that's correct.
So I think the best way to provide support for this family member is to be there, to pay attention, to listen without judgment. That means to say active listening, active and empathic listening. Sometimes we love to talk, but I hope you are able to understand that at this time, your family member needs somebody to talk to. But it really depends on the degree of stress that this family member is experiencing. It depends on how he's presenting. Is he experiencing extreme mood changes? If it's experiencing behavioral problems, if it's creating problems within the family, I think that that's something else. But for you as a family member, if you notice that, let's say during this pandemic, you notice, let's say let's say a family member lost. Okay. A family member has lost his job and is worried about financial status. Maybe right there and then be there to listen, but eventually try to support or promote self-efficacy by providing more, I would say, clearer steps on how to solve the problem solve, in other words. I hope that answers your first question. The second question is about how will you deal with if there's a difference between adult and child. Yes, definitely there is. Children, especially for younger children, they need more visual cues, and you need to go down to their level. So maybe you need to use pictures. And if for very young kids, if they ask questions, you strike a conversation, and then you ask them what they hear. If they ask questions, make sure you give them answers. And as I said, sometimes they use visuals, so maybe you can use pictures, play materials. There's a lot of resources that you can use for child and youth. If you want, I can provide you with that. For adults, it's totally different. So I said, make sure that you only get information from credible sources. I would recommend getting information from WHO and the CDC, because otherwise you'd get conflicting information. But how will you deal with their mental health needs really depends on the severity, depends on the age. Whether you have a child, a very young child, a school age child, or an older child, let's say, or a teenager, that it's different. Yeah. So I hope that answers your question, Faye.
Yes, thank you, Dr. Daisy.
You're welcome.
Thank you, Dr. Daisy and Faye. Now we will call on Lenny. Lenny, please unmute.
Hi. Oh yes, sorry, I didn't test my mic. Am I on now? Hey.
Yes, please go ahead.
Oh, all right. Sorry to interrupt. No, I like the quote. Life is not about waiting for the storm to pass. It's about learning how to dance in the rain. And thank you, Dr. Artus, for this amazing session. And I was taking a lot of notes. So we all agree that the level of stress and depression which we all experience may be different because of our different roles or different exposure during this time of COVID. We have some of us are healthcare workers, counselors, family caregivers, or even frontliners. I myself, I'm both. Like I'm a caregiver for a senior, and I also work as a career practitioner, coaching people looking for jobs. Now, we have heard today that mental health is of great importance to all of us, and especially during this time. Now, and we've never been so concerned about our health except for this season, right? For this time. Now, my question is, how do you think culture, values, and the perception of people has affected the way we deal with this trauma or with stress and depression? Can and then my next my last tiny question is, can an ordinary person be a mental health advocate? I think you probably answered that by giving us the guidelines, but I want to repeat my question. How do you think our culture, values, and perception has affected the way people deal with trauma? Salamat po.
Okay, thank you, Lenny, for your question. Yeah, definitely. The culture where we're coming from, or the values which we grew up with, definitely will affect how we deal with stress. Because looking at Filipinos, we are very spiritual, and this is how we cope as a nation, right? But if you look at what happened when the pandemic started and we can no longer go to church, that has affected our the cultural value, the value, the the value that we grew up with. We cannot go to church. We cannot practice our religion. We cannot practice spirituality. So that's definitely has the pandemic has affected our mental health in that sense, because spirituality is an important component of mental health. The way we perceive the pandemic will also affect our ability to cope with our own mental health. Remember, if we are experiencing stress, grief, and loss at the time, it will really the intensity of the impact depends on our current mental status at that time, our current physical health, mental health, or the available resources for us, whether or not we have family, whether or not we have a good job, whether or not we are comfortable, whether or not mentally, if you're comfortable in your own home, will really affect the way you deal with stress, loss, and grief. But with psychological first aid, regardless of your cultural background, regardless of your values, psychological first aid is very relevant. So it should not be a factor. So you can always practice psychological first aid, which I think an important thing to connect with your second question, because to become a psychological first aider, you don't have to be a mental health professional. We can all advocate for mental health. As I said, I am a psychiatrist. Yes, I diagnose and treat mental illness, but I am a strong advocate for mental health. Anybody can be a mental health advocate. Anybody can be a psychological first aider. You don't need clinical skills.
Great. That's very encouraging. Thank you.
Yeah, so, but it's good to, yeah, I hope I answered your questions about culture, values, and perception.
Yes, yes, very much. Thank you very much, Doc.
Thank you, Lenny.
Thank you for that, Lenny. Dr. Daisy, I have another question here that is also somewhat related to what you just answered. It deals with the importance of culture when it comes to balancing mental health. This was sent in by Dolly Castillo. She's a prominent member of the Filipino community here in Alberta. She's the president of the Babae Council. Her question is, and I will just read this verbatim. How is the gap between cultural values of the birth country bridged in the process of transitioning of integration to the adopted country, especially for newcomers? I espouse a psychologist or psychiatrist of the home country of the patient, be on hand in the treatment of delicate cases such as suicide cases. Cultural values and expectations play a big role in how the patient feels when at the crossroads of transition from old to new environment. That's her question, and she looks forward to your answer and to the highlights of your discussions. Thank you.
I will try my best to answer the question, but I think this is it is a totally different topic, because this is my understanding of the question. It seems like it's related to the experience of being a newcomer and how you integrate the old from the new. To me, this is a different. It's always difficult. When I came here as an immigrant, I went through the same process, and it was hard letting go of your own cultural beliefs, your practices, and I think. I do understand that it's when you're moving as a newcomer, you experience a lot of you're experiencing stress. I'm sure you might experience the different stages of grief, because you're moving to a different culture. But if you decide to imbibe a new culture, this is a choice. But I don't think we can totally forget or stay away, or maybe how do I say it? Hindi natin pwedeng kalimutan lahat kung ano yung ating pinanggalingan. But this is where your own mental health plays a role. Because that means to say, if you are very rigid in your thinking, that means to say, ganito ang practice ko sa Pilipinas, bakit ko papalitan? And now you're in a new setting, you're a newcomer to Canada, and this is how you think. Maybe I would suggest do some self-reflection, because you're going to struggle with adjustment. You're going to struggle with adapting to a new environment. I think this is a very good question. This is very interesting in the sense that it takes a whole new concept about mental health within the context of a newcomer, not just in the COVID-19 health crisis. Am I correct, LV?
Yes, I think.
Sorry.
Hi, Dr. Daisy. Yes,
Yeah.
that might be what Dolly was
I hope.
asking.
Can you? Okay, I don't see her, and I don't see her question here.
Yes, she sent it in advance. She was supposed to be one of our panelists, but she couldn't make it.
Okay.
She still wants to be part
So I
of-
don't feel. I don't right now. I don't feel like I answered her question enough.
I think it's definitely relevant, and a lot of people would understand what you meant when you were answering it. I think, yeah, that identity that we have to be confronted with once we move to a new country. Yeah. All right, so for the attendees, all participants who are now present, you may wish to type in your questions using the Q&A box. Yes, anonymous questions are allowed. So if you wish to not disclose your identity because your question is a bit sensitive, you may still do so. All right, so we have one. Kritzia, sure. Let me see if I can put you on air. Kritzia is asking if she can ask her question verbally. Okay, hold on. Let me just try. Someone is raising her hand, so I will allow her to talk. Okay, Kritzia, you're now on.
Hi, Dr. Daisy. How's it going? My name is Krizia Carlos. I actually work as a mental health nurse. I work with adults and adolescents, and also I'm an artist and work with YEP. You guys can hear me, yes?
Yes, of course.
Awesome. Actually, I was with Tita Dolly yesterday. We were doing an intergenerational discussion, which I found it fascinating to be able to hear her question. It was like super well worded. It was great. I kind of wanted to add on to her questions because she talked about the differences in culture, but I think culture also involves like the different generations. So, for instance, like the generation, it feels like this is a kind of continuation of our conversation yesterday, but like if the culture from which like say the adult generation uh, comes from and like the younger generations are coming from, like it's a different world. So I think as I'm trying to formulate my question, how would the approach be to addressing mental health in within these like generational um, concerns, and is that not concerns, but um, in like this generate different generational type of landscape.
So the question is, how do you approach the mental health needs based on or within the context of this intergenerational needs?
Yes, because
Correct?
if we're
Yeah.
talking about helping family members, have family members are made up of
Oh,
you know, ate kuya, lola, growing up from different generations, different type of mindset. So how do we communicate
right.
mental health in a way that is that can be received um, by by the generations, not only through the age, but also there's like there's different Filipino, there's different mindset if you grew up in the Philippines. So for instance, for me, I would consider myself like 1.5 generation. So I grew up, I moved to Canada when I was about 10, and I was able to have a little bit of part of my mindset formation was growing up in the Filipino culture, but then most of my life, half of my life, more than half of my life, I grew up within the Canadian culture. So there's a generation aspect to it, but there's also like country culture type aspect to it.
Yeah. And your question is how to approach mental health within the context of the differences in the generations. The way I would conceptualize your question would be within the we're now in, I think this is generation Z. X, Y, Z.
Yeah.
We're now
Yeah.
in Z, but I think we still have a lot of millennials, Generation Y. Um, for those who are in this particular generation, they need short and concise answers, and they need quick responses. They need quick changes. They especially, and for the generation Z, they experience immediate gratification. They want quick results. But that's why what you see right now, now that the economy is starting to open, more and more cases of COVID-19 are diagnosed among the young adult population. That's primarily because these are the young adults who are restless, right? But I think your question is, how will you approach this? How will you address this in order to curb? Is that what you're saying?
Yeah, actually, it gave me a little bit of a different way to word it. As you brought up, this generation wants like everything quick. So how can we build a culture of resiliency in a quick, quote unquote, quick fix generation?
I think that's why we're using the virtual communication. This is the only way to reach them. This is the only way to educate them about mental health and about coping during the health crisis. And quick answers, clear and concise, immediate feedback, that's what they need.
Okay, thank you so much.
I hope that would help.
Mm-hmm. Yeah, I think it helps a lot too. But I do think that there's like a stance, and like it does take time to like understand certain things, and I just like I observe a lot of like the young people and like the culture that young people are growing up in, and also like being in mental health and seeing the influx, increased anxiety all all
Yeah.
over, just spiking up everywhere. Yeah, so I'm trying to understand how we can build a better like culture of resiliency within like this societal context of wanting everything in quick fixes.
I think it's tough.
Yes.
It's very complex needs for this population group.
Mm-hmm. Yeah. All right. I'll let someone else put out a question, and thank you so much for hearing it out.
Thanks for that, Chrisia. It's very. Oh, am I mispronouncing her name? Chrisia. Sorry about.
Yeah. Yes.
Yeah, I think that's very relevant for sure. The generational differences in experiences would give us different needs when it comes to mental health. So I'm glad that that was raised as an issue.
Mm-hmm.
We still have time. So if Faye and Lenny have further questions or follow-up questions, please feel free to raise them.
Yeah, I think I have a quick one. I grabbed the opportunity right away. Are there actual cases of recovery, meaning, or is there a way to measure the recovery of people from this trauma? So like, I know that this is still ongoing, but earlier on, like it started in March, and then people are probably spending time thinking about how they can cope. Now it's summer, and it's actually like August next week. So have you had any encounters of some people who were able to succeed from the trauma that they have experienced? For example, as a frontline worker, or maybe someone who had COVID but was able to cope with the mental stress or the trauma that they've experienced, if you are aware.
Okay.
Thank
Yeah.
you.
So I think your first question was how do we assess level of functioning?
Yeah,
If
that's
that means
true.
to say
That is true. Yeah.
yeah, that means to say, were you resilient? Were you able to cope with the stress from the
Yeah.
pandemic? I would say, again, going back to your mental health. So are you able to go back to your own level of enjoyment? Do you enjoy going back to work? I think it's that's how I would see your level of functioning, work, relationships, play, everything. School is another thing. I have no direct experience with somebody who has been diagnosed with COVID-19 and is now successfully integrated back to work or play or family life. But I guess it must be hard going back to the community, especially I think this was a question raised before about the stigma of having been diagnosed with COVID-19. Because yes, especially for those who have a limited understanding of what COVID-19 is all about, and again, because there's a lot of unknowns in this illness, then that puts somebody at risk to experiencing more anxiety and depression. Yeah, so I think it works both ways. The person who is recovering from COVID-19 and those around him. But I think your point was this is how I understand your question. Are there stories of people who we can use to inspire us to be more resilient, even if
Model.
still yeah, to inspire us. Yes, we're not done with the pandemic yet.
That's true. Yeah.
But I think This is one way of promoting hope and inspiring people. This is the silver lining. This is the silver lining. This is the meaning of everything. So yeah, so I would think I think there's a lot of inspiring stories. In fact, Alberta Health Services is asking us to come up with those stories.
Yeah. And I think our community, Konjan is here. I think our community really plays a great role in this one because we're really out here and there's a lot of leaders and we can do something about advocating and promoting how mental health is important to everyone, regardless of
Right.
your culture. Thank you.
Thank you for that. Thanks for the question, Lenny. Okay, so we are right on time. We would like to thank Dr. Daisy, and you now have 5 minutes if you want to air your concluding observations and closing message. And you can also summarize what you would like for everyone to remember as the key takeaways of the discussion.
Yeah, I think I cannot underscore the importance of our mental health.
Daisy, I'm so sorry for cutting you. I just know
Yes.
there is an anonymous question here. So before you wrap up, maybe you could answer this.
Can you share? Can you share? So I'll just read the question. So can you share with us practical tips on how to set boundaries at work when work from home has become somewhat a norm due to the pandemic and with communication technology making us accessible 24/7? Okay. This is an interesting question because how can you set boundaries? I think when you're asking about boundaries at work while working from home, I think this would all boil down to your schedule. If you have to learn how to set limits, that means to say, yes, you are working from home, but you cannot be available 24/7. That's how I understand this question. And speaking out, I think is the best way to
Mhm.
the best way to discussing this with whoever you're working with, and yeah, telling them about your limitations. Okay, what happened? I
Oh,
think would be the best way, the best answer to this question.
if you would like to view the question again, Dr. Daisy, I clicked it as answered, so it's now under the answered tab. Yeah, so I think this covers work-life balance and the importance of boundaries in this evolving work environment that we have, with work from home becoming the norm in many offices and workplaces, and how people have different ways of adjusting to this new normal, if you will.
Yes, and I think her question also states that with communication technology available 24/7, then this makes working from home more demanding, more complex. But I think this will all boil down to setting your limits. Just like what we do in therapy. We set a time frame for therapy. We set how often, how much the therapy goes beyond the time limit. I think this should also be the same way when you're working with at home. I mean, from home.
Mhm. Are there any good techniques as to how to communicate these limits that we are setting?
Assertive communication, I would say, is important.
Mhm.
Yeah.
Yeah, because in Filipino culture, we are very deferential to.
Mm-hmm.
This
Yeah.
is a challenge for a lot of us. Yeah.
Yeah, that's the thing with us Filipinos. We don't communicate. We're not very comfortable with opening up. But I think in the Canadian setting, we should be open to talking about how our own mental health. That means to say, if work is starting to be more stressful, if you're feeling upset, make sure you talk about it. You speak out.
Right. So that's something we should all work on. And
There's another question from Krisha. May I ask my question verbally?
Oh, I
Or
think
is this something? Oh, okay. So this is done.
that's it. And so far, I'm checking it again. There are no more questions, so you may proceed with your wrap up, Dr. Daisy. I apologize again for cutting you off earlier.
That's okay. But yeah, I think I've said everything I wanted to say during the presentation. But the take-home message really from this is that you cannot underscore the importance of your mental health, especially at this time of the health crisis. Because yes, we have to stay physically healthy, but you know, it's easy to recover from fever. It's easy to recover from cough. But when your mental health, when you're experiencing grief and trauma, this has longer implications, repercussions, and learning how to deal with it right now, processing the experience, making sure that it becomes part of our psyche is healthier for our own mental health. Yeah. So do not be afraid to speak about your mental health because this matters. And stay in the here and now. Practice mindfulness. Thank you very much once again.
Very good words to remember. Thank you, Dr. Daisy. May we now call on Consul General Zaldi for his closing remarks and to formally end this session of the PCG Online Forum Education Series. Conjen?
I think we just had a very engaging session. We exceeded our time a little bit, but I think that's okay for everyone. And I am truly thankful to Dr. Daisy for sharing her knowledge and expertise with us today and enlightening us on the topic of mental health. I believe many of us felt happy because somehow we got free consultation from a very competent professional psychiatrist. Thank you, Dr. Daisy, for all the pointers you shared on how to effectively manage our mental health situation, depending on which stage we are in right now. I believe everyone who listened today will have many positive takeaways from this session and that all of us now have a better understanding of our own mental health. We may also feel that we are not the ones affected by negative mental health, but we may know others who are. I hope that we will take the opportunity to reach out to those needing help at this time. I also wish to thank our reactors for this session, Lenny and Faye, and also Krisia, for making this session livelier with your questions and comments. To all our followers who stayed with us throughout this session, maraming salamat po. On August 7, Friday, 5:30 to 7 p.m. same time, we will have our third session under the PCG's Online Forum Education Series, where we will have the representatives from the Philippine Overseas Labor Office, or POLO, and the Overseas Workers Welfare Administration, or OWA, in Vancouver, speaking about their programs and services for the Filipino Temporary Foreign Workers, or TFWs. We are not only inviting the TFWs to join this session, but also the members of our community. Because at one point, you may encounter Filipino TFWs who are seeking help. You can then share with them useful information or refer them to POLO, OWA, or even the PCG now that you have become familiar with our services. Salamat po, and I hope all of you will stay safe, healthy, and well. Magandang gabi po sa inyong lahat.
And that ends the PCG Online Forum Education Series. Thank you and good night. Okay. Let me just go back. I think it went, where is it? So sorry about that.
Elvie?
I will now end the webinar. Thank you, and I apologize for that glitch.